and thank you for being part of Exercise is Medicine Greenville. My name is Nikki Sen, and I am a part of the program design team. I will be guiding you through this first webinar discussing the program philosophy and development and the program building blocks. Before we begin, we would like to give a special thanks to Dr. Ann Blair Kennedy, who led the program design team that designed the EIMG program and planned version 1 of these trainings. Her time and effort laid the foundation for the EIMG Pro training that we have today. To start, you should have either received or downloaded a copy of the EIMG Fitness Professional Training Manual. You may want to keep it with you as a reference as we go through this webinar. If you have not received the EIMG Fitness Professional Training Manual, please download it from the EIMG Pro portal. This webinar series is required in addition to receiving your EIM credential. It will orient you to the EIMG program and clarify expectations of you as an EIMG Pro. After completing this first EIMG webinar, you should be able to discuss the program philosophy and development, describe the EIMG program modules, and explain the differences between the essential and recommended building blocks of the program. The EIMG program was designed by experienced exercise professionals, research experts, and EIMG staff from GHS, now Prisma Health, University of South Carolina School of Medicine Greenville, YMCA of Greenville, and ACSM in response to the National EIM Solution. It is currently the only program of its kind that partners a healthcare system, a university and medical school, and a community care center. I would like to thank all of these individuals for their time and dedication to creating this excellent program. The program aim is to provide adaptable exercise sessions with comprehensive education, instill patient confidence, and facilitate independence that will help patients develop positive lifestyle behaviors which can treat, prevent, and potentially reverse chronic disease. The overarching goal is to help referred patients develop positive lifestyle behaviors, which includes helping them to meet the federal physical activity guidelines of 150 minutes of moderate to vigorous intensity aerobic exercise per week, and 2 days per week of muscle strengthening exercises involving major muscle groups to improve chronic disease signs and risk factors. You, as the EIMG Pro, will be providing 2 one-hour classes per week for a total of 12 weeks, with a goal of graduating the patient into high self-efficacy for independent and safe exercise. Flexible and adaptive. What does that mean? Research tells us that all programs that are implemented will be adapted in some way, which can possibly negatively impact the results of the program if this is not planned for. Therefore, we specifically created a clinical exercise program that you as the EIMG Pro would easily be able to adapt to how you teach best. In other words, we did not create a program telling you exactly how to get your patient moving and prescribing a curriculum for you, the pro, to follow. We are not telling you exactly which mode of aerobic exercise and specific resistance exercise to prescribe to your patient. Instead, we created a program that allows you as a fitness professional to adapt the program to your particular strengths and to the preferences of the patient in order to reach measurable goals. In designing the EIMG program, we identified essential building blocks and recommended building blocks. Think of these as guidelines to help you create your classes for your patients. The essential building blocks must be provided by the EIMG Pro in your sessions for the patients to truly see benefit. The recommended building blocks will enhance implementation, provide class enrichment, and possibly improve patient satisfaction within the program. Now we will be getting a little further into the program, and I'll talk about the program principles. We have created 2 separate modules, and you will place your patients into one of these modules based on their primary diagnosis. This diagnosis is found in the information distributed to you by your facilities coordinator. The 2 modules are the cardiometabolic module and the musculoskeletal pain module. Each of these modules has a primary focus. The primary focus of the cardiometabolic module is to improve cardiorespiratory fitness, and the primary focus of the musculoskeletal pain module is to improve functional capacity and/or reduce pain. So, for example, a patient with a primary diagnosis of hypertension would be placed in the cardiometabolic module, whereas a patient with lower back pain or osteoarthritis would be placed in the musculoskeletal pain module. With both modules, there are 3 additional principles for the entire program. First, the training is progressive. We want you, the EIMG Pro, to start slow with each patient and build their fitness up as they continue through the program. Some of the patients at the beginning of the program are extremely deconditioned, and the progression is necessary for safety and to help prevent pain and injuries. Second, full body training is used. All major muscle groups should be addressed, and while single joint movements can be used, they should be kept to a minimum. Third, the education is integrated into the exercise activities. We will get more in depth into this later, but just know that the education portion should not happen in a classroom type setting. We want the patients moving as much as possible during the time they are training with you. Now I'll share more detail about the modules and how they are similar and different from each other. For each module, we have identified a set of essential and recommended building blocks, which we will go into more detail in the next webinars. But for now, we'll just get a general overview of our modules. For the cardiometabolic module, patients will spend more time in aerobic activity, and the education focus will be on the management of chronic diseases. For the musculoskeletal pain module, patients will spend more time in resistance training, and the education will focus on pain management. For this module, we've also included an additional essential building block of mobility and stability, and an additional recommended building block of mindfulness. Both of these additions are not included in the cardiometabolic module. These modules should help to guide you in thinking of how to train these individuals. In your EIM credentialing, and potentially in other past educational experiences, you learned how to work with people with or at risk for chronic disease and appropriate exercise recommendations. These chronic disease diagnoses will indicate which module you place each patient into. You should be aware that your patients may have secondary diagnoses, which can impact the module that they were originally placed in and how you train them. For example, a patient may have a primary diagnosis of type 2 diabetes, but also have a secondary diagnosis of fibromyalgia. This could be information about the patient provided to you at the time of referral, or you could discover this information in your first meeting with the patient, the orientation appointment. The way you prescribe exercise and plan each session needs to be based off of the type 2 diabetes primary diagnosis, working within the building blocks of the cardiometabolic module. But you will also need to consider how the patient's fibromyalgia will impact their abilities and participation in class. You may add in some mobility and stability exercises or mindfulness activities included in the musculoskeletal pain module to help improve functional capacity and/or reduce pain. However, your focus should still be on the primary goal of the cardiometabolic module, improving cardiorespiratory fitness. Our current qualifications for a patient to be referred into EIMG by their provider include patients engaging in less than 150 minutes per week of physical activity, patients diagnosed with or at risk for chronic health conditions such as high blood pressure, type 2 diabetes, and high cholesterol, patients with abnormal BMI, patients with musculoskeletal weakness and/or pain. Additionally, patients who are identified with high-risk conditions may be referred to clinical rehabilitation programs. Listed here are the common chronic disease diagnoses that you will encounter as the patient's primary diagnosis and their appropriate module placement. As discussed, be aware that you may discover other diagnoses for your patient, so please use your discretion to design a safe and appropriate individualized exercise prescription for your patient. How is the program formatted? You will be delivering 2 one-hour classes per week for a total of 12 weeks. Currently, we are offering the program in small groups with a maximum class enrollment of 7 patients. We implement EIMG in multiple sites throughout the community. The essential building blocks are program concepts that must be completely executed in order for the program to be considered fully implemented. In the next webinar, we will discuss in more depth how these essential building blocks will be implemented. But for now, we would like you to think about the titles and what they might lead you to do in practice. You'll notice that each building block has 2 titles. This will help with communication to different audiences. We've identified a healthcare or fitness professional title, which is the first title, and a public title, which is in parentheses. Understanding both of these titles will help you when communicating with different audiences. The essential building blocks include aerobic exercise or build stamina, resistance training or build strength, active education or build learning, lifestyle change or build commitment, and mobility and stability or build mobility and stability. Start imagining what you might do with these essential blocks in a 1-hour class. The recommended building blocks are designed to help improve your class and your patient's happiness and satisfaction with the program. The third webinar will cover the recommended building blocks in more detail. For now, think about what the titles bring to mind and how you could implement these concepts into your class design. The recommended building blocks include enjoyable classes or build fun, demonstration or build by example, recommended exercise outside of class or build independence, social environment or build connection, and mindfulness or build focus. When we consider all of our building blocks, we have a strong base of the program with our essential building blocks. These are the foundation. We can improve the program by integrating the various recommended building blocks into our class design. All of the building blocks utilized together are under the umbrella of successful implementation. In the next webinar, we will go into more detail with the essential building blocks and discuss the progression guidelines. Thank you. Have a great day.